It feels like living inside a haunted house, honestly. And you can't escape because that haunted house is like inside of your mind.
It felt like a cloud of some kind of foggy haze over who you know underneath you are and who you know, you kind of start missing yourself.
It's this like cloud of gloom that just like sits on my shoulders.
It's hard to like make yourself do anything or perform or achieve.
It's like you'd get to the restaurant and order the best plate and be at this place you're super excited to be and then just stare at the food and not be able to taste it.
It feels like being dunked underwater and screaming and like no one hears you. It can feel very lonely. It can feel haunted. And just like you're stuck.
Hi, I'm Dr. Jessica Yu. I'm a licensed clinical psychologist and senior director of patient experience at Hims & Hers. When most people think about depression, they think about this unfathomable clinical disorder that's characterized by intense sadness. But depression is actually a constellation of symptoms. And those symptoms include things like feeling hopeless, feeling worthless, feeling empty, having difficulty concentrating, not being interested in things. And when people experience depression, they might not feel like eating or sleeping or doing the things that they usually do. If that's the case for you, then seek help right away.
We were on vacation at the beach and we worked really hard to get to this vacation and really hard for this child and all of this, everything was kind of everything I'd wanted to get out of life. And I couldn't participate.
We all feel down from time to time. Life happens and our emotions go up and down and sometimes we just feel sad. If there's a specific event that has made you sad and it goes on for a couple of days, maybe a week, that's not necessarily a cause for concern. But if you're feeling down, sad, disinterested in things, a lack of pleasure, maybe you're noticing that sadness is interfering with things that you need to be doing or want to be doing, like going to work or going to school or taking care of your family or engaging in relationships, and that it's going on for some amount of time, typically we say 2 weeks or more, then it's time to look for help.
I think that's the depression part, is that you know there's something there, but you don't know how to put your finger on it. And you don't know what it is necessarily. And as much as I tried to justify and nerd out and point it to something like, I'm just feeling this way. There was a certain moment on that trip actually where my partner turned to me and said, "What's wrong?" And I just started crying. I didn't know. This is beyond me. This is something that is more than what I am, more than what I know how to handle.
Sometimes I'll wake up in the morning and I'll have this like great plan of the things I'm gonna do today. And I'm not getting out of bed and I'll just like turn right around and I'll grab my phone. I like to play a lot of puzzles. So I'll just like grab my phone and I'll just play puzzles for hours on end, not having had breakfast, not showered, not even like gotten up to say hello to like the rest of my family. But I'm just like, I feel so bleh. That's the only way, just so bleh, that I don't want to move. I don't want to face the world. I want to stay underneath my covers where I don't have to face life in this moment.
There are essentially 2 different types of treatment for depression. The first is talk therapy, like cognitive behavioral therapy. And the second is medication. Both have been shown to be effective in the treatment of depression.
I would say to my younger self or to someone who is struggling with anxiety or depression, that there are tools out there, and it's okay to ask for help. It's okay to ask for support.